alcohol guidelines say that you can consume this much, you can consume this much, this is safe, this is unsafe. There are so many guidelines. But actually, WHO recommends that you should not drink alcohol. And that is the take-home message of all these things. So, depending on, there is a global context. There are a lot of people consume alcohol. There are cultural differences, ethnic differences, then region-wise also. This is also a status symbol now. Alcohol consumption has become a status symbol. हम क्या एक पार्टी में ही जाते हैं, बाकी तो कुछ नहीं करते हैं. ऐसा बोल के people used to take alcohol almost every day in a week. Suppose if you ask the patient how many days do you take alcohol, he always say no, I will take only one peg in a week or like this. If he says one, he must be consuming 3. That is very sure. And the percentage of alcohol which has been recommended scientifically, if you want to take it safely, is 25 to 30 grams of alcohol. So what is the 25 to 30 grams of alcohol? It is hard drinks, they contain 40% of alcohol. It is a 40%. That means you can have maximum 70 ml. It is a 2 drinks. For male, it is 2 to 3 drinks. And for females, maximum 1 drink. It is allowed. That is 30 ml. So there is a gender difference also. So you have to be very cautious in telling the patient, because patient will definitely ask you, "Arey doctor sahab, bahut studies aaye. It is supposed that alcohol is very safe, and particularly red wine le lo, red wine se kuch." Basically, we try to compare ourselves with the Western culture. When you are comparing ourselves with the Western culture, Western people, what they do, they sit there for hours together. They will consume a glass of wine for 2-3 hours. But here, wine also people used to consume like anything. They are drinking it like a water. So that becomes a problem. And because there is no, people always think that there is some literature, it also comes in the newspaper and all these things. So people will go according to that. So there are worldwide alcohol use remains widespread across the, I will not go much detail, I will try to complete in next 10 minutes. These are the dietary guidelines from America. This is a nutrition communication. Adults of legal drinking age, that means the age more than 18, choose not to drink or to drink in moderation by limiting intake to 2 drinks. 2 drinks means 30 ml, 2 drinks. 1 drink is supposed to be 30, it is not 60. So maximum you can have 60 ml, so it becomes less than 30 grams. If you count percentage wise. And for men, and 1 drink or less means, if less means that you should not drink, females particularly. But if you want to take 1 drink, is allowed to take for females. And there are certain positive effects, which is said to be the cardiovascular effect, then it is mental satisfaction also. It is said that it gives a social drinking, we call it as. So you can have maximum 1 to 2 drinks for male, and less than 1 or 1 drink to the females. Drinking less is better for health than drinking more. There are some adults who should not drink alcohol at all, particularly patients who are diabetic. There are chances of getting high hypoglycemia very much. So you have to be, so this is about this is the low risk alcohol drinking guidelines, 0 to 2 standard drinks per day for females. And what happens now in our culture, suppose somebody is taking a drinks, he will ask, so अरे डॉक्टर साहब ने 8 दिन तो कुछ नहीं लिया, तो 8 दिन का एकदम लिया तो चलेगा. That becomes a common question which will be asked by the patients. So if he takes, it is a binge drinking, and binge drinking is worse. It is not allowed. So if the patient asks you, you are allowing me to 1 or 2 drinks, so I will drink 10 pegs in a day. It is a binge drinking. Binge drinking is supposed to be bad. WHO recommends no alcohol. Level of alcohol consumption is safe for any type of patients, male or female one. This is a positive health behavior. There are different studies which suggest that alcohol is little bit safe. It prevents cardiovascular morbidity and mortality and all these things. But it is these studies. So these are the controversies. I have been asked to talk on controversies. There are certain positive things, certain negative things, but maximum are negative things. So you have to keep it in mind. Advise adults with diabetes and those at risk for diabetes who consume alcohol to not to exceed the recommended daily limits. Advise abstainers to not to start drinking alcohol even in moderation. Educate people with diabetes about the signs and symptoms of hypoglycemia, because these patients are likely to go for hypoglycemia. This is about percentage of alcohol. How much beer contains is almost 5%. It is about the hard drinks, and it is almost 40% if you see all other drinks. And wine, it is almost 12% of alcohol. So foreigners, they drink 200 ml of alcohol, wine. 200 ml of alcohol, it becomes a 24 grams of alcohol. So maximum amount of alcohol you can drink is 25 to 30 grams. So alcohol metabolism, all of us know that alcohol gets metabolized in the liver, so I will not go into the details of this. What are the potential benefits of moderate drinking? There are different studies which say that you can have moderate drinking. Moderate drinking means how much it is? It is 1 to 2 drinks for a male and 0 to 1 drinks for a female. More studies say that improved insulin sensitivity with the wine. Moderate drinkers may show reduced cardiovascular risk. Light alcohol intake, sometimes linked with the longevity. Wine with meals shows beneficial metabolism is going to increase. If the patient is diabetic and if you do his sonography, you are going to get fatty liver disease. The fatty liver disease there and you are alcoholic, there are chances of getting liver transplant, in particular people, are very high. So relationship between alcohol consumption, it is a J-shaped one. There is epidemiological evidence that prospective cohort studies offer mixed conclusions. So risk reduction only seen in select subgroup of patients. There are not all patients who are, their risk is reduced. So you have to be very cautious in that. Impact on glycemic control, alcohol impairs gluconeogenesis. We know that liver is the factory of gluconeogenesis and it is going to affect there. So there is no gluconeogenesis, the chances of getting hypoglycemia are high, and these patients are likely to go for hypoglycemia. The risk is especially high with insulin therapy, and particularly the patients who are on sulfonylureas, insulin secretagogues. These patients are more likely to hypoglycemia if you are consuming large amount of alcohols and because of alcoholic liver disease. The association of habitual alcohol intake with risk of cardiovascular disease. Alcohol consumption at all levels was associated with increased cardiovascular risk. Clinical and public health guidance around habitual alcohol use should account for the considerable differences in cardiovascular across different levels of alcohol consumption, even those within current guidelines. What are the cardiovascular effects of the alcohol? A light alcohol use once linked with lower cardiovascular risk. But there are so many controversies. Some studies say that it reduces the incidence of cardiovascular risk is increased. Another few suggest that because of obesity and all these things, there are chances of getting more cardiovascular risk. Alcohol contributes to hypertension and endothelial dysfunction. Many patients, if you take the history of patient who is hypertensive, if he consumes alcohol almost every day, there are chances of getting uncontrolled hypertension are very high. The dose-response relationship appears to be non-linear and complex. Moderate drinkers often are healthier due to lifestyle modification. Basically, these patients have a guilty feeling. And if you go for a jogging or swimming, half of the people who are drink yesterday night, they are there for a swimming, because they have got some guilty conscience. Then overall cardiovascular risk increases at higher consumption of alcohol. So this is another study, alcohol consumption and cardiovascular risk. Possible that this is observational studies may overestimate the benefits of alcohol for cardiovascular disease outcomes. Moderate wine consumption is probably associated with low cardiovascular events. It is a probability. There are many co-founding factors, in particular lifestyle, genetic and socio-economic associations with wine drinking, which likely explain much of the association with wine and reduce cardiovascular events. So this is about the alcohol use and cardiovascular diseases, scientific statement from the American Heart Association. If how much alcohol you are consuming, the effect on blood pressure, effect on coronary disease, effect on stroke and atrial fibrillation. You can see here, the randomized controlled trials, heavy alcohol increases the incidence of atrial fibrillation. Observation, it exceeds more than 1 drink per day, the chances of getting atrial fibrillation are comparatively high. Even sudden death, these are randomized control. These are the different studies which already I spoke, so I will not go into detail of that. This sudden death, if you consume 1 drink per day, there is chance of sudden death is less. But if heavy consumption is there, the chances are of sudden death are high, because patients are likely not only for atrial fibrillation, the patient may go for arrhythmias, different type of arrhythmias. In sensitivity in some studies, chronic intake increases the insulin resistance via hepatic effects. NADH accumulation alters hepatic insulin signaling pathways. This is the enzyme. Visceral adiposity worsens with prolonged alcohol consumption. So patient may go for obesity and other metabolic syndromes like dyslipidemia and hypertension. And the mechanism, intermittent binge drinking disrupts glucose insulin dynamics. So there are chances of getting hypoglycemia in these patients and uncontrolled diabetes as well. The mechanistic findings differ between rodents and humans. This is a liver-brain axis of neurodegeneration hypothesis. We know that ethanol acts on liver. Then there is a steatohepatitis, it causes insulin resistance. Then there is a release of cytokines causing insulin resistance and inflammation and neurodegeneration. And there is a direct neurotoxic and metabolic effects which lead to insulin resistance, and ultimately it leads to the neurodegeneration. So this is the liver-brain axis of alcohol-related disorders. Effect of alcohol on cardiovascular risk factors, which already I have spoken in details. Mostly moderate intake causes decreased oxidative stress, reduction in blood pressure, increased HDL cholesterol. Excess intake causes increasing excessive intake causes other hypertension and increased triglyceride levels. Mechanisms, lipids and inflammation, HDL increase seen with modest alcohol intake. Inflammatory cytokines are elevated with chronic use. Alcohol disrupts lipid particle size and function. Acetaldehyde contributes to endothelial inflammation. Oxidative stress burden increase in metabolic tissues. Impact on liver health, all of us know that these patients are likely to go for cirrhosis and hepatocellular carcinoma if not stopped at earliest. The relations between alcohol consumption, BMI and type 2 diabetes, you can see the conclusion here. Potential predictive effect of alcohol use against type 2 diabetes seems to be specific to women in general and women with BMI above 25. The implication that BMI and alcohol are both involved in development of type 2 diabetes. The sex difference, we know already, I spoke about that. The youth and adolescents, early alcohol exposure alters metabolic set points. Adolescent drinking linked to adult obesity. So if you take the history of adults, people who are obese, they give a history of alcoholism. Elderly and alcohol use, we know that elderly people, if they consume excess of alcohol, they go for hypoglycemia. So there are chances of getting fractures and they become serious also. The binge drinking, I already spoke to you about this. Interactions with anti-diabetic drugs. This is an important slide. Alcohol interacts with sulfonylureas and chances of increasing hypoglycemic risk. So patients who are on sulfonylureas and insulin, the chances of hypoglycemia are very high if they consume alcohol and they doesn't eat much. SGLT2 inhibitors with alcohol may increase ketoacidosis. GLP-1 receptor agonist plus alcohol may impair gastric motility. Patient must be warned about pharmacological interactions, and the personalized advice is crucial based on treatment regimes. Obesity and alcohol, we know that if you consume excess of alcohol, there are alcoholic fatty liver diseases and chances of getting metabolic syndrome are high. Genetic variability, already I spoke to you. Cultural, religious perspectives, I will not go in detail. The clinical recommendations are important. Abstinence remains the safest choice for patient with metabolic disorder. If drinking, it should always be with food. Patients should avoid binge or episodic heavy drinking. Women face greater risk at lower alcohol exposure, and people with diabetes require tailored clinical counseling strategies. Discussion must include risk of hypoglycemia and weight gain. So guidelines changes. The global bodies increasingly recommend lower use of alcohol. Canada now advises 2 drinks per week maximum. So they are changing guidelines continuously. WHO wants no safe level of alcohol. They say don't drink alcohol. Guidelines shift driven by cancer and CVD data. US dietary guidelines under periodic expert review and shift towards more conservative alcohol thresholds globally. What are how you are going to counseling these patients? Ask patient directly about alcohol consumption. Encourage monitoring of glucose continuously after drinking. Warn about interaction between alcohol and medications which are taking. So many patients are on sulfonylureas or insulin, so you have to warn them about chances of getting hypoglycemia. You have to warn them about getting hypertension and obesity. and advocate these patients about avoidance of drinking on empty stomach and document discussion regarding alcohol use in medical records. So thank you very much.